Welcome to The Source, where we combine the headlines with in-depth conversations with the newsmakers themselves. Today on the program, health authorities intensifying the campaign against the Wuhan coronavirus.
All international airports, yung Bureau of Quarantine standard yung ating operating procedures. Nagkataon lang talaga na ang most direct flights natin from China are in Manila, Calibo, and Cebu.
Thousands have been infected.
Make no mistake, this is, though, an emergency in China. But it has not yet become a global health emergency.
The government beefing up measures to prevent the spread of the virus.
Hindi ho kami selective. Ang guidance ho ni Secretary Duque, lahat ng pasahero pong, lahat ng flights patungo ng Manila o many other airports, kailangan ho i-double check at paigigihin ang pagbantay. Hindi ho kami naging selective.
Is the Philippines ready to face the novel coronavirus threat? Health Secretary Francisco Duque III joins us live. Thank you for joining us. I'm Pinky Webb. More than 50 people have died in China after contracting the Wuhan coronavirus. Over 2,000 people confirmed infected as the virus rapidly spread among China's regions and other parts of the world. The World Health Organization is not yet considering the outbreak as a public health emergency of international concern. The WHO, however, maintains that within China, the Wuhan coronavirus is an urgent public health emergency. Containing the virus has just become more challenging as China's health minister reveals people can spread the Wuhan coronavirus even before symptoms emerge. In an all-out effort to stop the Wuhan coronavirus, China is now banning the trade of wild animals. A market in Wuhan that sold wild animals is the suspected source of the coronavirus outbreak. Meanwhile, the country's transportation lockdown has been extended to the southern port city of Shantou in Guangdong province. Those lockdowns now cover about 63 million people in 16 cities. Chinese President Xi Jinping has ordered all infected people, approximately 2,000 patients at this point, to be treated in centralized quarantine. CNN's David Culver has more from Beijing.
China's President Xi Jinping ordering local leaders to stop the spread of the deadly coronavirus, calling it a grave situation that China is facing right now. Now, health officials seem to be responding. Sunday, they announced some extraordinary containment efforts. Those efforts include sending some 1,600 medical personnel into Hubei province towards the epicenter of this virus. They also have already on the ground some 1,300 military and civilian medical personnel. Now, President Xi has also asked that medical staff are protected and that supplies gets to those who need it. We have been telling you about some of the dire situations that folks are in there. Healthcare workers telling us that it feels as though they're going into battle without any armor. They're lacking hazmat suits, lacking goggles, lacking protective face masks. Well, the health officials on Sunday here in China announcing that they plan to step up production immediately of some of those hazmat suits. They say they need an estimated 100,000 hazmat suits each day. Currently, production is only at 13,000. So they're bringing in workers in the midst of this Spring Festival holiday to start up production once again. Meantime, this as tens of millions of people find themselves in what seems to be a widening lockdown zone. And the folks there are describing a very difficult situation of uncertainty and unease.
I woke up feeling quite.
Let's go straight to the source of the story. We have Health Secretary Francisco Duque III. Secretary, thank you for your time. I know you're very busy. Maraming salamat.
Maraming salamat din. Thank you for the opportunity.
First and foremost, sir, are there any confirmed cases of the novel coronavirus in the Philippines, sir?
Zero.
Okay.
The first test sent to Melbourne, Australia, was a specimen collected from a child from Wuhan, 5-year-old, in Cebu. And that turned out negative, thankfully.
Isa-isahin natin, Sec, kasi ang daming lumalabas na mga kaso. The 5-year-old was the first one I remember, sir, that was reported. And I remember speaking to you, sinabi, di na lang nga sa Australia because we don't have the capacity to confirm the virus. So the 5-year-old were safe. He's safe.
Well, we have 11 PUIs as of the moment. These are persons under investigation. 2, which one of the 2 is close contact, the other one is for verification yet. We have 3 experiencing severe acute respiratory infection, but no history of travel to Wuhan. And then we have 23 considered influenza-like illness. Because, you know, this is the season of influenza today in the Philippines, okay? So that's 39 all in all. But of these, we are closely monitoring 11 PUIs, persons under investigation, which means they more often than not presented with symptoms of fever, coughs, colds, some shortness of breath, and then a travel history in Wuhan. And then 1 or 2 of the 4 exposures, such as number 1, the history would reveal if any of these passengers actually was in direct contact with a confirmed case of novel coronavirus. And then number 2, if the passenger inbound, that is, has had interaction with a person or a health worker in a healthcare facility known for taking care of a novel coronavirus. Number 3, if the passenger indeed did stay or visited the epicenter, which is the live animal market, the seafood market in Wuhan City. And all these exposures are being drawn out from the passengers.
So 11 are persons under investigation. This excludes the 5-year-old boy already?
Yes.
Okay, sir, I want to go back to the reports one by one. The 5-year-old is negative of the novel coronavirus. What about the family, sir, of the man who was not allowed to leave Hong Kong, but yung pamilya po niya ay nakarating po dito sa Pilipinas from Hong Kong?
They turned out negative.
Wala na rin yun. What about there are reports also of a possible patient in Dumaguete, sir?
I will have to look into, ang hirap kasi, you're talking about places, but what is important is all of them went through the Bureau of Quarantine's screening, surveillance system, which is very much in place. I will have to look into my listing as of January 26, 12 p.m. Suffice it to say that the PUIs, they are, this is with RITM, the first case, a 7-year-old, Region 7, okay, Chonghua Hospital, Wuhan, so not detected.
Siguro balikan natin na lang
Not
yan
detected. So, anyway, kasi this is very, very granular already.
Yeah. No, but the thing is, Secretary, the reason I bring it up is because it's coming out on various posts. There was one in the... Would you be able to tell us about the one? It just came out very recently in Palawan. It's a Brazilian family. The father, though, sir, had a sore throat and a 10-month-old baby with a high fever. And suspected coronavirus also in El Nido, Palawan, sir.
Hindi, it's negative.
Negative yun?
Yeah, negative.
Okay. And then, sir...
It's bacterial infection.
Kasi pero may history ata sila ng travel sa Wuhan, that Brazilian family. So that's also negative, sir. What about the report, sir, about the Metropolitan Hospital in Binondo?
I think it's also negative, Binondo Hospital ba, sabi mo?
Yes, sir.
Binondo Hospital. Diliman, Chonghua. Wala pa sa akin.
Okay.
Of the 39, there has been no report as to the Binondo case.
There was some social media posts yesterday, sir, that we need to confirm or debunk these reports, sir. You actually call it something. Yung po mga lumalabas sa social media.
Infodemics.
Infodemics,
Oo,
okay.
Yeah, this is what the virus of miscommunication
Yeah.
or false information can be more viral. Can be more viral than the virus we are guarding against. And this can cause a lot of anxiety and undue fear. I think we have to be
very careful, sir.
Very careful. We have to verify. We have to validate. Do not absorb all this news just because you find it in social media, and then you start propagating it. Then you become an instrument of the infodemic.
And I want to bring this in, Secretary. There were social media posts last night. Mabuti sa inyo na po manggaling that there was a patient that was brought to a hospital in Alabang, tested positive for the coronavirus. Dinala daw, nag-secondary test sa Asian hospital. I don't know if you've heard about this.
No.
Nag-positive din daw and is now under quarantine. Any information, or is that fake news, sir?
I think it's fake news because, first of all, they're saying it's positive for coronavirus. Who says that patient is positive? Who confirmed it? Unless you give me an answer, I'll say there is no basis.
Okay, so next, sir, just another one is also in RITM, there was an incident yesterday, and this is coming from a friend, sir, of one of an employee saying that they were in RITM yesterday, sir. Kasi alam naman natin, dapat pagka-positive ho ba, suspected rather, dinadala ho ba sa RITM?
What do you mean?
A patient.
A patient, yes. Basta the assessment tool, there is what is known as the decision table. This is an assessment tool that will show whether a person belongs to the PUI category.
Person under.
Yes, the person under investigation.
Investigation.
Which means nagkaroon ng fever, coughs, colds, tapos nagkaroon ng history of travel to Wuhan, and then yung 4 exposures that I enumerated. Okay? So, kung gano'n, ang gagawin, number 1, kukunin ng Bureau of Quarantine Officer yung kanyang health declaration card or the yellow form. Okay? Number 2, that will be admitted as a case of PUI. Number 3, the patient will have to be isolated. Number 4, kukunan ng throat swab. Yun ang padadala specimen to RITM. RITM does the testing. So, nobody in his right mind can ever say, oh, positive yun for
So
coronavirus.
any hospital here, sir, or anywhere
They do
here,
not-
except
nobody-
RITM,
yes, they-
cannot say that you are positive of coronavirus.
Not even
sir.
RITM. That's why we are sending to Melbourne, Australia.
Yeah, but sir, RITM can do a first confirmatory test, right? And then you do the secondary.
You don't call it confirmatory.
What do you call it?
RITM just can do the testing, the preliminary testing. Just like what happened, as an example, the 5-year-old Chinese national from Cebu, who thankfully tested negative according to the Victorian Infectious Disease Reference Laboratory in Melbourne, Australia. So, yun, ang first, negative for SARS-CoV, negative for MERS-CoV, but positive for non-specific pan-coronavirus. That's not the same as novel coronavirus. It's a non-specific, so hindi identified exactly if this is the same as that one found in Wuhan City. Okay, so this had to be sent, and only then did Melbourne, Australia said, it's negative. Yun.
So parang
So pag kami nagsabing positive, don't. You always, you always doubt it. The first responsible thing to do is, if you know there is uncertainty about the information, do not be an instrument of propagation of the false or unverified information, lest you sow the seeds of fear, of anxiety, of confusion, and I think this is really a terrible disservice, especially if we are responsible media practitioners and also
citizens
of this country. Themselves. Yes.
So, ang tama ho sigurong sabihin, would it be correct to say suspected?
Well, suspect, may technical meaning yan.
PUI na lang, person under investigation.
No, tatlo yan. Meron kang PUI, meron kang suspect influenza-like illness, which means you have colds, fever, coughs, but no history of travel to Wuhan, no exposure to one of the four I have just enumerated.
Okay. All right. We'll be taking a very short break. We'll be right back. You're watching The Source on CNN Philippines. Our guest today, Health Secretary Francisco Duque. Sec, how about any patients right now, patients or persons under investigation sa RITM? Meron ho ba?
Meron, of course. In fact, well, of course, it's very, I don't know how many were sent home, how many are in isolation. So meron tayong isolated. I would assume all these 11 are isolated.
And you're assuming that they're isolated in RITM?
Yes.
So ang mangyayari, I was trying to understand.
Or some could be possible in also other hospitals.
May isolation area naman in other hospitals.
It's part of our scaling up. That's one of the measures that we have put in place. There are 7 measures that we have put in place. One, we have set up the task force on novel coronavirus. Number 2, we have already issued out the interim guidelines on novel coronavirus. Number 3, we have heightened border surveillance and including thermal scans, and also, of course, the reinstitution of the health declaration checklist, and then we have issued out also the assessment tool or the decision table, so to speak. So malaman mo who is PUI, who is SARI, who is suspect ILI. Okay?
What's ILI?
Influenza-like illness. Okay. And then we have done laboratory and hospital preparedness. We have scaled up, the personal protective equipment, and then the collection and testing of specimens, and then the establishment of the novel coronavirus surveillance with daily reporting, and risk communication in all communications platforms, quad media, to counter precisely the infodemic.
Secretary, some schools have suspended classes beginning today.
In China?
No, sir. In the Philippines, sir.
Oh, yeah? I
yes.
don't know. Which school is this?
There is one. We're going to put it up on the screen right now.
Are they at risk?
Well, hindi, sir. It just says this. Uno High School. To all parents, students, teachers, and staff. Sir, this is very telling. Sabi po nila, for those who have traveled or whose family members have traveled to places where cases of the coronavirus infection have been confirmed, such as these countries, and to areas where numerous visitors from Wuhan were reported, such as Boracay, etc., must inform the school about their trips and go on self-quarantine for 2 weeks after the date of arrival. Is that a good idea, sir? Pag self-quarantine na po sila, they're actually encouraging people to self-quarantine.
No, you have to wait until the DOH gives out the advisory. After the DOH consults with the WHO, we have to wait for the WHO. We cannot just, if they want to do that on their own, it's really up to them. Okay? But the DOH must exercise caution and prudence in making sure that verified information is available from the most credible sources, and do not supplant the sources of credible information with personal opinions and personal conclusions hastily jumped into. So, because if you do that, that's very lamentable. So we wait for WHO.
So that's something you don't. It doesn't seem you're too happy with what the school did, sir, suspending classes.
I don't know what the situation there is, but I don't know. I have no idea. I have to look into this. That's the better response to your query.
Yeah, and it's not just that high school. There's another one. It's at Chiang Kai-shek also, suspending school today as a precautionary measure in relation to the outbreak. There will be no classes in all levels at both Padre and NARA campuses tomorrow, January 27th. That's today, 2020. All teaching and non-teaching personnel are, however, required to report to work to discuss the school's plans in relation to this issue.
Oh, that's better. That's okay.
That's fine.
All teaching, yeah, that's fine. Let's wait for, we have the guidelines, and these actions are not in accordance with our guidelines.
Opo. I know. Hindi nga po eh. So that's why I'm asking you, is that a bad idea? Because it's not in accordance with the guidelines set by the DOH. DOH hasn't said, hindi ho ba?
Well, I don't want to say it's a bad idea. All I want
Do you
to
agree with
say
it?
is that they're doing it. They have to have some reasons, which up to this point, I am not aware of those reasons, but I'm willing to listen.
Okay, good, sir.
Yeah.
Diba? Okay, let's talk about airports. Tourist arrivals, sir. The fact that there were still, sir, I want to stick to this, tourist arrivals coming from Wuhan. Last week, sir, no? I know that the total lockdown from Wuhan started Thursday of last week. Pero may nakarating pa rin nung araw na yon. Pero pinabalik na po natin in 3 batches. Ano? That still brings about some concern among people. Sir, do you suggest, or are you possibly looking at other areas wag na pong papuntahin po dito sa Pilipinas?
Yeah, I think that's a decision that we have to await the advice of the WHO, because they're more or less, aware of what's happening. They have people stationed across China. So let's see what China does. But it's best that China does this ahead of everyone.
Sila na yung maunan doon sa
Sila
mga
na mauna,
lockdown, sir?
because they're an autocratic state. Once they said, hindi pwede. Wala nang mga, hindi gaya sa democratic states.
But when they implemented the lockdown, sir, that was Thursday of last week. The cases of the coronavirus began since early January, hindi ho ba? Wasn't it a little bit too late?
Well, yes, I would agree if that is your personal
No, I was asking you,
view.
sir, if it was a little too late.
Yeah, I guess it's a little too late. But, as they say, it's easy to judge when it's hindsight is 2020. But I think they've been relatively more transparent than during the SARS of 2002, 2003, where it took 89 days before they disclosed it. And so led to about 8,000 cases globally and sadly about 800 deaths for
took
a
about
10
3
to 12%. 10 to 12% case fatality rate. MERS-CoV was 36% case fatality rate, very high. And in this case, it looks like consistently it's hovering around 2 to 3.5%, 2 to 4%. So this is relatively much better than both SARS-CoV and MERS-CoV.
SARS and MERS.
And CoV, yeah.
Okay, again, we'll be taking another
Better.
short break. We'll be right back. You're watching The Source on CNN Philippines. Our guest today, Health Secretary Francisco Duque. Sir, we have 4 minutes left. Okay. How do you get, when you get it, sir, di ba sabi kailangan meron kang, maliban na dun sa history, no? May fever, may ubo, may sipon. Kailangan ba one of those present or two, or any of those present, you can be a person under investigation?
Yeah, of course. Either you have fever, you don't have coughs and colds, or you have coughs and colds, but you don't have fever, but you had travel history from Wuhan, and then exposure to the 4 items I just enumerated, you will automatically be considered or admitted as person under investigation.
Okay. All right. And then let's put this in, yung 56 deaths still so far.
Yeah, 56 deaths over 2,014 cases, both in China and outside of China, in all the other countries where this have been found, accounts for 2.7%, which is a far cry from the MERS-CoV, which was 36% case fatality rate and about 10% for SARS-CoV.
Ang pinakamataas pala MERS. And then SARS was 10%.
But MERS had less infected persons. But relative to that, the number of deaths was really high. So 36%.
Sec, I just want to bring this in. There's a tweet by former COMELEC Commissioner Lara Zabal. He's saying that it's a miracle. Pagkatapos po nakita nating mapa na infected na yung other citizens in other countries, that we still don't have a confirmed case, considering that there's so many flights to the Philippines from China?
Yeah, well, that's good.
Very good.
That's very good.
There's one.
Yeah, but you know, the situation keeps unfolding. It's still fluid. So it's not good to make hasty conclusions. So, you know, we have to be discriminating with the kind of information we receive and propagate.
Yes.
Okay? So we shouldn't be an instrument of infodemics, of, you know, false information that can be more viral than the virus we are guarding against.
And Sec, the best thing to do, again, we're going to have to repeat it over and over again, sir. Wear a mask. Ano pa ho?
Okay, personal hygiene. Okay, washing of the hands, 20 seconds, say the Our Father, sing the Happy Birthday, you know, the palm, the back,
Pati yung dito.
and the digits, o yung mga daliri, o maglagay ng alcohol. Do it as often as you can. Before eating, after you've touched, you know, your phone, your whatever, whose
Let's remember,
items.
madumi yung phone, di ba?
I know, it's on the phone. It's one of, you know, you culture that, you see a lot of bacteria. Okay, so this is not just limited to the usapin novel coronaviruses, but also other microbes, bacteria, you have Haemophilus influenza, you have Streptococcus pneumoniae, you have all these other opportunistic infection. Opportunistic because if your resistance is low and you're essentially temporarily immunocompromised, you open up the floodgates to all these bacteria.
Right.
So even if they normally don't cause disease or problems, they will. So palakasin ang resistensya, drink a lot of water. Because if the throat is dry,
Yes.
that's the time these viruses very easily enter the
Please
system.
remember that. I
Yeah.
just read that.
So,
You
water,
have to keep your throat moist. Oo. Kahit daw sip lang kayo ng sip ng tubig kasi a dry throat can, bacteria.
Oh, you don't have water and I have.
I have here, sir. Nandito naman siya. So, okay. Health Secretary Francisco Duque. Sir, maraming salamat po sa inyo. Thank you for your time and thank you for joining us here on The Source. I'm Pinky Webb. You're watching CNN Philippines. You know what, sir? I think what's new.